Good morning, educators. Welcome to SB Connect, where we connect to and educate for the world of work. This is Health Professions Week, and during this session, we are going to meet Melissa Huynh, Program Director at Crafton Hills Community College, talk to us today all about Radiologic Technologist. And so I want to introduce you to Melissa Huynh and her students today. Thank you so much.
Thank you for having us. Like I said, like Michael had introduced me, I'm Melissa Huynh, the Program Director for Arrowhead Regional Medical Center School of Radiologic Technology, affiliated with Crafton Hills College. And these are our second-year students, Berlin, Mia, and Steve. So I'm going to tell you a little bit about the program. The students usually, before they can actually apply to the program, they have to complete their general education courses for an associate's degree and complete the 6 prerequisite course before they can actually apply to the program. And these is important because the associate's degree is the minimum requirement that qualifies them to take the national board exam. And then along with the prerequisite course, it's the medical terminology, anatomy, physiology, and the survey class to our program, along with your English, computer, and math class. So the thing is, once all those courses are completed, the students will actually meet with the counselors, and then the counselors will sign off that they completed everything before they can apply. And then we go through a list of all the applicants and select the applicants based on their interview to see if this is for them. And during the interview process, we actually we can kind of gauge what the personality and how they're going to get along in the medical field. Importantly, it's like work experience. They have to be, and it's important for the medical field that the students or our applicants are compassionate, willing to help and care for the patient, because this is what they're going to be doing for the next 22.5 months during the program. They're going to be taking x-rays, taking care of patients day in, day out. And the program itself is very intense. It's a 40-hour week, so it's like a full-time job. So the students, the classes are held here at the hospital. If the students are not in class, they're on the clinical floor taking care of patients. So the thing is, at Arrowhead, we're a trauma center, so we deal with a lot of different scenario cases, different type of patients. We have our regular patients. We have trauma patients who were just recently in an accident, so they were brought in. So we have to care and take their x-rays. We have behavioral health patients that we do take their exam. We have incarcerated patients. We have homeless. We have burn patients as well so the thing is, out of all of this, we can't pick and choose our patient. So that's why being compassionate is very important in the medical field. That's basically part of it. And then you have to be, as an individual, you have to be a team player to help out in cases as well, because it's just not a one person exam. There are times where you're going to be like needing 3 or 4 people to help you, especially with trauma cases. The thing is, basically, you just have to be flexible and willing and wanting to jump in to help the case and help the patient. So that's basically, for the program for the most part. And then as into class-wise, the students take about 6 to 7 classes per semester. So the classes are held here at the hospital. They have an average of 2 to 3 quizzes, tests per week. So they study at home, depending, outside the 40 hours here, they study at home, and this is based on their study habits. Some people might take longer to study for the test. Some student might take shorter because they have a good photographic memory. But every student is different, and we do work with them, and every student's lifestyle is different, because certain students have family with kids and certain students don't, but they're all adjusted and they help each other out in the program. And we're one of the few hospital-based programs left in California. So they're more like the students here. We only accept 8 students per year. They're more like a family, seeing each other day in, day out for 2 years. They see each other more than their own family, So that's why it's important that, as a prospective students, you understand that this program is very intense. When we tell you it's intense, we mean it. So it takes a lot of perseverance to get through this program, and a lot of dedication to get through this program. There's other programs out there, but the fact that our students start off like clinical right away, like after their orientation, we kind of just guide them into like patient care, start calling patients, verifying patient information, getting the patient dressed, so they get comfortable with their clinical skills. So this program is strongly clinical skills-based, hands-on, whereas into the other program, they have like classroom settings first for the first semester. So it's not very hands-on, and the thing is, it depends on how the students learn. Some students they learn better when they're hands-on, so they retain the information more. So I can say that our students are strongly clinically, they're clinically strong when they graduate from this program, and they can basically go work anywhere else. And this is proven by our former graduates working at other hospitals. Do you have any questions for me? But it's like, and the thing is, another thing is.
Go ahead.
Oh wait, we got some questions.
Yeah.
How do you join the program?
How long is the program?
Yeah.
22 and a half months long. So almost 2 years.
How much do you guys get paid?
We depend on what facility you are gonna get hired at, and different facility get paid. We're county, so we get paid lower compared to Kaiser, but this is all based on experience as well. But just, and I forgot to mention, our program, we accept program, but the thing is, all the students have to pass their background check and drug screening. And me, it's very important, because this doesn't just apply to our program, but it applies to all the medical fields, actually.
So is Kaiser the best facility to be at?
As into work-wise?
I think he meant in terms of salary.
Salary, it does depend on, yes, because they're private. But for us, the thing is, we give and take, and the thing is, like, the culture is different. Here, our program, we're trained here at the county facility, so we do have a lot of teamwork. We have a lot of team effort of all the students jumping in to help out. They work alongside with the technologist one-on-one. So they get the hands-on experience from like day one after orientation. The thing is, students work, they help each other out. They work well together. So that's why it's like, this program compared to other programs, the benefit we have is the fact that we are a trauma facility. So we do have a lot of different scenarios, different cases of patients, different type of exam where the students do have to think outside the box. Because, you know, we do have outpatient too, but these outpatient patients, they come in, they're walkie-talkie. So it's easy for us to just like, you know, position a patient. But with the trauma cases, we have to think outside the box. We still have to provide the views for the doctors so they can actually see what is going on with the patient inside. And the thing is, most places, they don't have that trauma experience. So here, we're fully, our students are fully trained for that. And if they have any questions or any questions about positioning or technique-wise, how much radiation to give, there's a technologist alongside providing the answers for them and helping them out. You know, like if they questioned, we're like, okay, we can try this. So it's like, they have a good opportunity of they're exposed to a lot of stuff. So that's what our students are, the advantage of that compared to other programs.
I would probably add in as well too, our program also offers a chance to branch out into other modalities. So what's cool about that is other modalities might pay more depending on what you do, maybe like MRI, CT, different things like that. So after you graduate, get hired kind of based, I think the average starting, probably you're thinking salary like 70,000 a year to start. But of course, once you get more licenses and branch out into other modalities, you have a chance to make more as well.
Important thing is, as a prospective students, where you're starting off, you know, try to keep your grades up. Good grades matter. Make sure you're not getting in trouble, because we do a background check and drug screening. You have, you know, if you have a misdemeanor, the thing is, you might not qualify to take your national board, where you're gonna have to write a letter to the national board, the committee, and then they'll, you know, they'll tell you whether you can take the board or not. So the thing is, that's why it's like, it's important that we have a good background, a clean background, because the thing is, there's no point of you taking, completing the program and cannot take the national board exam. Because you can't, if you can't take your national board exam, you're not licensed. So that's why it's like, it's important for you to actually keep that in mind, keep your grades up. Important is background check and drug screening. We do all that before we accept students. And if, for instance, we can't have students, although marijuana is legal, but we can't have students at the hospital being high on something. So that's why it's important, and that's why I want to mention that to you, so that way you can actually think about it, because you guys are still so young, and it's your opportunity. And the thing is, another thing is, because we are at a county facility and based on our geographic location, Spanish is very helpful. Take, you know, another language. The thing is, we will teach you, I guess, Spanish terms that are related to our field, so that we can actually take care of the patient during that exam. But at least just have the basic knowledge so that you can actually kind of communicate, because it makes it easier for you to position the patient during the exam. I mean, I understand like we have the translator, but the thing is, like, that's more for consenting, more for the I guess other exams, but just like general, like patients coming in, you just want the patient to like lay down or take a deep breath, then, you know, the basic Spanish will actually get you through the exam.
All right, so my name is Steve. I was in the military, and when I got out, I looked for a different profession. And what really interested me was the medical field. Primarily because I wanted to help my community out, and I've had a lot of surgeries and x-rays done on myself, and I feel like giving somebody a proper diagnostic x-ray or MRI or something in that field can help somebody with their medical recoveries in the future. And I wanted to be part of that and help somebody recover from whatever situation they're in. So that was my reason why I joined X-ray, especially this program, just because they offer a lot of the hands-on right away. And that's my preferred method of learning. So I really got drawn into this program, and luckily I was able to join and participate in their program my first year of applying.
My name is Berlin. I joined this program because I was really interested in X-ray. My mother actually went through this program when I was young, so I got an opportunity to kind of see what she does as I was growing up. I got to go into the hospital, see what she does every day, and it really interests me. My background a little bit, I had some management skills, I had customer service, and so I felt like that really applied towards this particular role in the medical field, so that's why it interests me so much. And I'm glad I really did pursue it. I got to meet a lot of really great people and basically apply the skills that I had from previous areas and my passion growing up, basically seeing my mother go through this program to really apply myself. So that's really what interests me in X-ray.
My name is Mia, and what interests me in X-ray, I've always wanted to be in the medical field, and what primarily interests me was the hands-on experience that you get with each patient, and you do make a slight difference by getting that optimal image for them, getting a great X-ray for the doctor to read, and you do make a slight difference, and you keep going. You keep seeing another patient throughout the day. You see lots of patients in different situations. And like I said, you make that difference by getting a great image for the doctor. And I take pride in that and enjoy that. And I wanted to take pride in something I do and I want to do for the rest of my life. And this program gives all of us the opportunity to do so and get hands-on every day and make differences alongside with our technologists. So.
And to add on to Mia's as well too, you really are the eyes for the doctors, for the hospital, to see how they can basically treat their patient when it comes to CT, seeing if there's a break in the bone. So that's really neat to see that you're such a key role, such a key piece in the networking of the hospital as well.
So just to continue on, so after we're finished with this program, my plan is to apply at different hospitals. I mainly want to work in a hospital, not in a small little clinic. I like the bigger settings. I want to help more patients out, and that's the way I want to go. I prefer to be in a trauma hospital because I really like that setting. This place offers that. There's a few other places, not too many, but that's pretty much what I want to do. I just want to work in a hospital that offers the trauma. Now I can help out in that situation.
And us being thrown into the trauma situations really kind of gives us the clinical ability to go anywhere and be able to work under that pressure. It's not exactly like you see on TV shows where, you know, they wheel them into the room and it's so scary, but it is definitely a skill to acquire, keeping calm under pressure and being able to work consistently in a different fast-paced changing environment. And that's what's really cool about this program and really cool about this field is you're not doing the same thing every day. It's different, and you really have to use your skills to adapt and change. So it takes a special kind of person to do it. Not everyone can do it. Like Melissa was saying in the beginning, it takes a lot of perseverance. You got to know that this is what you want to do. Basically, it's hard to say. You can't really be in it for the money. You got to be in it for the patients. You got to be in it for yourself, your self goals. There's a lot of self motivation. Part of our clinical requirements is for us to be clinically competent in certain exams. So it's important to have that drive inside yourself as well because it's not necessarily somebody standing behind you, telling you, giving you a task on what to do every day. It's really you applying yourself and you pushing yourself as well to do great in the program. What I like about this program, what I plan on doing afterwards, I would still like to continue to work in a trauma setting as well, just like Steve. But there's other modalities that I might be interested in as well. This particular program offers mammography as well. So that's one modality that you can go into. It really just depends on what area that stands out to you when you are going through the program. And that's what's neat about this program is you can also branch out. You're not stuck in one spot. So that's what really interests me as well too.
And to piggyback on Berlin, the exact same thing. The opportunity to get into different specialties and modalities is amazing. And that's, we're already on our way and get our exams in and our clinical hours in different modalities. So that gives us even more opportunities in the future to branch off of X-ray and just go from there and, only expand ourselves and for the future. So that's, just like them, a hospital setting, trauma setting, to challenge myself every day. And the opportunity for other specialties is only added on to that. And we'll have that, skill as well, which is always nice.
So I'm gonna leave the students here for the conducting your questions and answers. So if you guys have any questions, this is your opportunity to ask, and they will tell you based on their experience in this program. These students they'll graduate in June, so they're close to, so they know the program. So this is based on their experience, and they're just gonna tell you, the truth. And the thing is, if you're not ready to apply for the program, or if you're not serious, please don't apply, because you're going to be taking a spot from someone else. Okay. So,
Now to the nitty-gritty.
Okay, group, before we go into Q&A, we're going to start a short video highlighting some of the aspects of radiologic technology at the California college system. Okay, we're going to cue that video.
My name is Longji Tran. I'm in the Radiology Technology program. It really started clicking that, I could see myself doing this for a while when I started doing my clinical hours. Just bringing a smile to a person's face. When you see that they've been down and they've been going through it, it's like, okay, that was pretty cool. And that's when it clicked for me. I was like, okay, I could see myself being a technologist. They require you to do a minimum of so many hours of observation before applying, just so that you know what you're getting yourself into.
When we graduate, we're just doing straight diagnostic, but there's also advanced modalities that you can get into, like CT, MRI. I mean, you have to go back to school and do some classes, but this program kind of sets you up for that. And during your clinical rotations, you get to see those things and find out what else you can be interested in. When you go out to your clinicals, it's kind of like a 2-year interview. People get to see how you work, you see how you fit in with different technologists, and so out of that you get a broad view of what you can expect in the workforce, and then after that, after school you can just apply and see where you go. You have to be very organized in this program, which is something I learned the hard way, because you have to retain everything. It's not like other classes where you can take the class and then maybe you use it down the line or maybe you won't. In this program, you use everything. So the more organized you are, the better off you are, and the better prepared you are at the end for your national exam. I will go to the community college route because, in the hospital, there's people that went to private schools, and I feel like I got just as much education as they did, except for I don't have big loans to pay back now. I feel like I'm just as good and just as ready for the workforce as they are.
So I have a question for you. While students are preparing to submit questions to the chat room, how long have you been in school to this point, and have you passed your licensing yet? That's for each one of you.
So we started back in August of last year. So we've been in this program for about a year and a half or so. We haven't taken our licensing yet. We don't do that until after the program, which we finish in June of this upcoming year.
And what does that licensing or that test look like? Or what do you have to prepare for?
So right now we are in our third semester, and we're going roughly we're just reviewing everything we've learned so far, and this is pretty much what we're going to be seeing in the boards. So they just throw everything at us right now. It's just a mixture of everything we've learned, to be honest. It's a mixture of positioning, radiation safety, exposures, what makes an image good, what doesn't make an image good, all sorts of stuff. It's just a bunch of things that they throw into the board, and we need to be prepared for that. And the video actually showed one of the ladies, she said that you don't just learn things in here like regular classes and just throw it away. You might use it later, you might not. She was correct. Whatever you learn in these programs, you're gonna need to know and keep those in your pocket, because you're gonna see that every day in this field. So you gotta know exactly what you're looking at, what you're doing, what you're giving to the patient as of radiation dose and stuff like that.
What our boards kind of look like, it's about 200 questions. You have to pass a certain amount of questions, I think 75 and above, to pass the boards in order to acquire your licensing.
And each one of you can answer this question. Did you start your training immediately after high school? And if not, what other subjects did you study to this point?
I didn't start mine immediately after high school. I actually had a full-time job. I was a manager. I was actually in photography for a while. And then I learned that I really wanted to do this. So that's when I went back to our community college, took the prereqs to get into this program. And then basically I would be continuing my education and acquired our AA degree through this program as well.
Same after high school. This was not even on my radar. I totally went to Orange County, did other things, went to college, and not until, a good while after then, I really just got down to really what I wanted to do. And that's when I started to, I went to Crafton, got the prereqs to get in, and it took me 2 tries to get into this program. The first time it was an alternate, and they picked 4 alternates and 8 students. So the 4 alternates are kind of on standby. And then I applied again the second year, and then I got in. So it wasn't right away at all, but.
So for me, after high school, I didn't think about this program either. Honestly, I didn't know what I wanted to do after high school. I thought I was too young to even know what I wanted to do for the rest of my life. So what I did, I joined the military. I was in it for 5 years, and when I got out, I knew I wanted to do something other than what I did in the military, which was law enforcement. I wanted to do something in the medical field, but I didn't know exactly what. So I went off and just did a nursing assistant just to test the waters to see if I even like something in the medical field, which I did. I realized that I love the patient communication. I love being there for them when they're in a bad situation, putting a smile on their face. And when I was a nursing assistant, I ran into a lot of X-ray techs, and I spoke to them, and the way they explained their job was pretty fascinating. I love seeing their X-rays when they took them there and then. My older brother, he also did X-ray as well for 10 years. So he talked to me about it, and you know what? After I heard all that, I just decided to join, and I found the Crafton Hills program, and I loved it.
And I want to add too, because of our ages, we're mid-20s to 30s, and I really do think the program takes a maturity level. It's totally possible to have really young students, but right out of high school, it does take a sense of maturity to be prepared, even for any medical job, in my opinion. But especially for the program, because it is very like mentally challenging with the school part and clinical part. So just wanted to add that. Like I said, it doesn't, hinder any younger person, because we do have them, but it takes a certain maturity level. So to really like get the whole idea of it and do really well.
Well, thank you for sharing that aspect. I'm sure some of our students would like to know, what are some of your most amazing images you've been able to take of patients so far?
Well, like I said earlier, I really want to work in a place that has and offers trauma, mainly because that's where you see a lot of the I guess you would say cool images. It's not cool for the patient, but it's cool for us to see and learn from that situation. The coolest thing I saw was this man. He was in an explosion, and he lost his legs and one of his arms, and it was pretty bad. But seeing his recovery was really good as well. It's not just that situation that we got to see; it was also his journey to his recovery, which is really well.
I would probably say that the coolest images that I like to see, we do something called fluoroscopy. And so we do a lot of studies where a patient might drink something that shows up in an x-ray. So you can actually follow it through and image it as it is going through and kind of see, I don't want to say like insides, but
Their anatomy
as it goes through. And that's always really incredible to see. We do learn a lot of different pathology and a lot of different conditions. So as you're seeing it, when these things do arise, it's kind of cool to see it in real life versus in a textbook.
And then I'll just mention this too, because so we do work in the operating room. They have x-ray, techs in there for surgeries, orthopedic surgeries, really any type of surgeries that would require, imaging what they're doing. So, and I think those are really cool. You're interacting with the doctor one-on-one and getting that image for them is really rewarding, because there's certain angles and there's certain things that you have to get for them, which is really cool to see. And it's also like open and you can see the bone, but then they want to see, different parts of it as well, and what they're putting hardware or anything like that, and they have to get the hardware just correct. So that's really cool to see as well.
Well, thank you so much. I know we're coming to the end of our session, but before we do, I want each of you to imagine yourself talking to your old high school self. How would you motivate yourself? What would you say to your old high school self today to help make it through to where you are now?
That's kind of hard to say. In high school, I wasn't mature mentally. I didn't really care about school, to be honest. I was just an average student, maybe even below average. But if I can go back and talk to my former self in high school, I would just tell them to what are you doing? You gotta pick it up, because it's tough. Life is tough, and you don't want to lose any time, especially if you've made some mistakes and you want to better yourself. You got to do it at an early age. So
I would say get a head start. Where I'm at right now, I wish that I had a little bit more time to kind of go through more schooling and go even further. So that's probably what I would say. It's don't mess around, just get a head start. And running start.
There's combined. Yeah, you focus more. Don't be aloof. Is that
Right.
with the world, and
Don't get caught up in what's going on in that particular situation.
yes, yeah. Just focus more. Definitely on schooling. To be honest, stay sane. In high school, I was probably below average, and I did not like school. And college was just very different. I liked it, and but I think it was more self-motivating. Got to be a lot more self-motivating, push yourself more.
What I would add on is being in high school, I would probably say just like work on your study habits, because like I said, I wasn't a good student back in high school, but when I went back to college after the military, I feel like I was in a mature state of mind, but my study habits were not the best. Like I had to learn that myself. I had to go to tutoring and all that stuff just to make myself even better than other people in my class, so I can have the opportunity to join a good program and have those good grades, like Melissa, the program director, said. So I mean, I would say as a high school, just pick up those good study habits, because you don't want to do that all over again in college. Because I had to, and it was not fun. Although I did really well, and I'm proud of myself for where I went and where I am now. But it would have made it a lot easier learning those good habits in high school.
Well, over here at the Alliance for Education, we want to say thank you for participating in the Health Professions Week session today. It was amazing, giving us insight into what a radiologic technician does. And so this will conclude our session for the day. We want to make sure that educators subscribe at our YouTube channel at SBC Alliance, where you can find this recording and other recordings that we have done this year, as well as going to our webpage at sbcalliance.org, where you can look up future SB Connect series. Again, thank you so much, students over there at Crafton Hills College. You have a wonderful day today.
You as well. Thank you.
Thank you.